Ureacin-20 Cream is used to moisturize and treat dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. It contains emollients that soften and moisturize the skin and decrease itching and flaking. Some ingredients like zinc oxide and white petrolatum are used to protect the skin against irritation. Dry skin is caused by a loss of water in the upper layer of the skin, and emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. This cream also contains ingredients like petrolatum, lanolin, mineral oil, dimethicone, glycerin, lecithin, and propylene glycol, which draw water into the outer layer of the skin and soften the horny substance that holds the top layer of skin cells together. This helps the dead skin cells to fall off, keeps the skin hydrated, and leaves the skin feeling smoother and softer. Remember to use this product as directed and to prime it if necessary. Some products may need to be shaken before use, so make sure to check the label. You can apply the cream to the affected areas of your skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. If you're using it for dry hands, you may need to apply it every time you wash your hands throughout the day. For diaper rash, make sure to clean and dry the area before applying the cream. If you're using it for radiation skin burns, check with radiation personnel before applying it. Be sure to apply the cream only to the skin and avoid sensitive areas like your eyes, mouth, nose, and vaginal/groin area unless directed otherwise. It's important to use the medication regularly for the best results, and it's recommended to apply it after bathing or showering while the skin is still damp. If your condition worsens or if you have any concerns, seek medical help right away. Some emollients may cause mild side effects such as burning, stinging, redness, or irritation. If these effects persist or worsen, notify your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risk of side effects. Most people using this medication do not experience serious side effects, but be sure to tell your doctor if you notice any unusual changes in your skin or signs of a skin infection. While it is rare, a very serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you are in the US, call your doctor for medical advice about side effects. In Canada, call your doctor or report side effects to Health Canada. Before using Ureacin-20 Cream, it's important to talk to your doctor or pharmacist if you have any allergies or if you have any skin cuts, infections, or sores. Some ingredients in the cream may make your skin more sensitive to the sun, so be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when you're outdoors. If you have acne-prone skin, look for the word non-comedogenic on the label to avoid any worsening of acne. It's also important to let your doctor or dentist know about all the products you use before having surgery. Lastly, if you are pregnant or breastfeeding, consult your doctor before using this product. When using Ureacin-20 Cream, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. If Ureacin-20 Cream is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek help immediately. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. To help prevent dry skin, you can use lukewarm water when bathing, take baths or showers less often, keep baths or showers short, and use a humidifier when the air is very dry. There are various emollient products available, including some with fragrance or other ingredients that may cause sensitivity in some people. These products come in the form of oils, creams, lotions, or sprays. It's best to consult with your doctor or pharmacist to find the right product for you. If you are using Ureacin-20 cream regularly and forget to use it as soon as you remember. Do not use more cream or use it more often than directed to make up for the missed dose. Make sure to check the storage information on the package and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Do not store the foam canister near high heat or open flame, and do not puncture or burn it because it is pressurized. Do not flush medications down the toilet or pour them into a drain unless instructed. Properly discard this product and it is expired or no longer needed. Consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.